Bacopa Manieri. Traditional systems of medicine use whole Bacopa Manieri, or a ghee-based emulsion, but people also take Bacopa in capsules, supplement blends, or extracts. The major ingredients in Bacopa extracts are chemicals called saponins, also called bacosides. Bacopa extract can come in water-based or alcohol-based and oil-based varieties also. The herb contains an array of active compounds that can affect your body and your brain. Each compound exerts unique effects, as well as synergistic effects when taken together in a Bacopa capsule or extract. Bacopa Manieri works by changing the levels of neurotransmitters like dopamine, serotonin, and acetylcholine in your brain. It also balances stress hormone levels like noradrenaline and corticosterone in animal studies. Not only can it modulate neurotransmitter levels, it may also increase cerebral blood flow and change the translation and expression of specific receptors in your nervous system. This is how Bacopa may improve learning, memory, sleep, relaxation, and mood. According to studies, Bacopa also affects the levels and action of brain-derived nootropic factor, or BDNF as it's known. Brain-derived nootropic factor is associated with increased neuroplasticity, which is the ability of your brain to change and to learn new things, and lower levels of depression. Brain-derived nootropic factor is also neuroprotective, meaning it protects against injury or damage to your brain and the nervous system. Another way that Bacopa exerts neuroprotective effects is through antioxidant, anti-inflammatory, and immune-boosting mechanisms. It can enhance the function of your body's natural antioxidant defense system, reducing oxidative stress. Studies show that Bacopa reduces hydrogen peroxide levels, lipid peroxidation, and other measures of oxidative stress that are associated with cell damage and inflammation. The health benefits of Bacopa range from increased memory and reduced anxiety to better lipid levels and reduced risk of cardiovascular disease. Numerous studies support that Bacopa Manieri has a nootropic effect in adults and children, enhancing brain health and memory. The cognitive effects of Bacopa Manieri are immense. At 320 or 640 milligram doses of Bacopa Manieri, it can improve multitasking stress reactivity and reduce anxiety during demanding cognitive tasks, allowing people to do multiple tasks at once. A meta-analysis of 437 healthy human subjects showed that Bacopa improved cognition and decreased choice reaction time. In a 90-day trial, 62 participants were given 300 milligrams of Bacopa extract per day, and they experienced improvements in spatial memory, working memory, and rapid visual processing. A review of 5 studies found that Bacopa Manieri improves language skills in children, including vocabulary, spelling, processing sounds, and understanding words. It also increases the number of items that children can recall during a test. In a study of 300 children, Bacopa improved spatial, working memory, and strategy. Bacopa reduces the perception of stress and anxiety in healthy people, as well as people suffering from anxiety. In a double-blind trial, the herb decreased cortisol levels and perception of stress during demanding tasks. In people with anxiety and neurosis, long-term Bacopa supplementation enhanced memory and learning. Bacopa can also reduce stress-induced damage to the hippocampus, which is the primary area of your brain involved in memory formation. Studies in rats have also confirmed Bacopa's anti-stress properties. Bacopa increases brain levels of brain-derived nootropic factor and serotonin, both of which have antidepressant effects, as well as other neurotransmitters like dopamine. In one study, Bacopa was found to help prevent seizures in epileptic patients caused by an imbalance of GABA levels in their brain. In a study of 120 children newly diagnosed with attention deficit hyperactivity disorder, or ADHD, researchers found that a herbal preparation containing Bacopa monnieri improved attention, cognition, and impulse control. In another similar study, children aged 6 to 12 who were diagnosed with ADHD before the age of 7 found that Bacopa reduced symptoms of ADHD and that the children tolerated it well. While the benefits of Bacopa for dyslexia have not been studied in clinical trials, preliminary evidence suggests it may be helpful. A neuropharmacological review of studies of Bacopa's effects on children found that it improved their language domain performance. Bacopa monnieri can have a wide range of anti-inflammatory actions in your body and your brain, most of which are caused by its antioxidant effects. An extract of Bacopa promotes the scavenging of free radicals and protects brain cells against cytotoxicity, which is cell toxicity, and DNA damage that may lead to Alzheimer's disease. Bacopa also has a dose-dependent capacity for scavenging free radicals and preventing DNA damage in prostate glands of aging mice, which may translate to human prostate issues. Bacopa can also inhibit brain inflammatory pathways by preventing the release of pro-inflammatory cytokines. Early in vitro evidence suggests that Bacopa may reduce inflammation in rheumatoid arthritis. Inflammation and cell damage appear to be major causes of Alzheimer's disease and other forms of dementia and degradative aging-related brain disease. Researchers speculate that Bacopa could reduce the likelihood or delay the onset of neurodegenerative and other age-related diseases by reducing chronic inflammation and other effects related to aging. According to a review of 6 different studies, Bacopa improved memory recall in people with dementia or significant cognitive impairments. Several studies have also found that Bacopa improves cognitive performance in healthy older people. In a study of 136 healthy older people, 300 milligrams of Bacopa extract caused significant improvements in memory retention and recall. In a study of 35 people over the age of 55, an extract of Bacopa improved their total memory scores, particularly logical memory and pair associations. Bacopa reduces beta-amyloid plaque formation. Beta-amyloid plaque is a major factor in Alzheimer's dementia. Studies of cell cultures and animal models predict that Bacopa may also be neuroprotective in Huntington's disease and Parkinson's disease. No large randomized control trials have yet demonstrated that Bacopa is effective in reducing blood pressure and preventing heart disease. However, there's limited human data that supports the possibility. In postmenopausal women, a Bacopa extract reduced LDL cholesterol, triglycerides, and blood pressure. Acting through the nitric oxide pathway, Bacopa reduces blood pressure in rats. Bacopa also protected rats' hearts against injury caused by ischemia and reperfusion. In rats, an alcohol-based extract of Bacopa reduced high cholesterol levels. Another study found that Bacopa, as part of a herbal formulation, protected against heart damage in rats. Bacopa also appears to protect against biochemical changes and heart valve issues in rats with high cholesterol. Mast cells produce and release histamine, which is involved in your body's allergic response. Bacopa acts as a mast cell stabilizer, reducing the production of histamine. In Ayurveda, Bacopa benefits those with asthma. Rat studies have found that the herb induced bronchodilation and reduced exhalation pressure, validating its traditional role in supporting asthma relief. Traditional Ayurveda's use of Bacopa to enhance the function of the immune system is validated by studies examining the effects of Bacopa on the immune system. Studies in healthy cells and cancerous cells predict that Bacopa and Bacopa extracts may help prevent cancer by preventing replication of cancer cell lines. This can cause cell death of cancer cells and increase antioxidant levels. In mice, oral Bacopa extract slowed the development of solid tumours. Findings in rats predict that it may help prevent colon cancer in humans. Bacopa's benefits also include its antimicrobial action. It inhibits Staphylococcus aureus, cholera, H. pylori, Salmonella, and E. coli, as well as antifungal activity against Candida and black mold. In systems of traditional medicine, Bacopa leaf juice is given to children to help alleviate diarrhea. Bacopa is also used traditionally for constipation and other stomach disorders. A trial with 169 participants demonstrated a possible benefit of Bacopa in alleviating symptoms of irritable bowel syndrome, or IBS. In normal rats and rats with type 2 diabetes, Bacopa had anti-ulcer and ulcer healing effects. Bacopa enhances mucosal defense factors in the gut, which may explain its anti-ulcer effects. Rat studies show that Bacopa protects against acetaminophen-induced liver damage by increasing antioxidant levels. Bacopa also may protect against morphine-induced liver damage. In India, fresh, whole Bacopa is crushed and consumed with cow's milk to help with irregular menstrual cycles. In postmenopausal women, an extract of Bacopa reduced insomnia, lowered blood pressure, and improved cholesterol and triglyceride levels. Bacopa monnieri is available in various forms. Dried Bacopa plant is sold as a powder or an extract, in capsules, in oils, and in mixed herbal formulas. Bacopa studies commonly use 300 to 450 milligrams of extract per day for healthy adults, but some studies have used 20 to 100 milligrams. Children and other sensitive people should start with a lower dose. Take Bacopa supplements 1 to 2 times per day before a meal with a full glass of water. Because Bacopa is fat soluble, it absorbs better if you consume some healthy fat along with it. Bacopa has few side effects and has low toxicity. Even children tolerate Bacopa well in studies. In numerous studies, people tolerated 20 to 450 milligrams of Bacopa extract per day with minimal side effects. The most common short-term side effect that people reported was nausea and upset stomach. There does not appear to be any negative chronic effects of Bacopa on human health. In one rat study, researchers found the upper limit was equivalent to a human dose of 25 grams of whole Bacopa leaf per day. There is very little evidence that extracts of Bacopa have caused any serious clinical, neurological, or hematological complications or damage to organs. Because it can increase serotonin levels, you should ask your healthcare provider for medical advice if you take selective serotonin reuptake inhibitors, or SSRIs, or any other prescription antidepressants before taking Bacopa. Bacopa inhibits liver enzymes called cytochrome enzymes, and these are involved in the metabolism of certain drugs. So ask a doctor for guidance before trying Bacopa if you're taking prescription medication. A study of Bacopa with amitriptyline, which is a tricyclic antidepressant, showed that Bacopa could increase levels of the drug.